I keep saying that I have a D in my bonnet, a D in my bonnet. There has been a mini explosion of new science over the last few years telling us loud and clear that, number one, rates of deficiency of vitamin D in America, and really in all parts of the world, are absolutely epidemic, and that vitamin D is not just about bone health. We know that vitamin D has a profound and pervasive effect in all parts of the body. It interacts with over 1,000 different genes, and vitamin D is involved in cancer protection, neuromuscular function, immunity, protection from autoimmune conditions, and cardiovascular health. So this is a huge deal. So many people are deficient, and scientists are studying this new story of vitamin D with the zeal and the vigor of a potential blockbuster drug. And I will tell you, if the current studies are confirmed, or the results that we're seeing from the studies for the last few years are confirmed in subsequent studies, in my professional life, I have not experienced a quicker, simpler, less expensive way to transform public health than to get everyone's vitamin D levels up to the optimal range. Now, interesting thing about vitamin D, guess what? You largely get it from sun exposure. Our hunter-gatherer ancestors, for 99.5% of the time the humans have roamed the earth, they were hunter-gatherers and they lived like outdoors. They didn't wear a lot of clothes and they didn't use any sunscreen. Well, we live indoors, we wear all these clothes and we're into sunscreen because we're paranoid about skin cancer. But unfortunately, all of those things block production of vitamin D in the skin. And vitamin D is really not available in foods with the exception of oily fish, which are the only foods that have it natively. Oily fish, like salmon and tuna and sardines. They are, thankfully, fortifying more and more foods with it. Dairy products have been fortified for years, decades, milk, but they're adding it now to juice and to cereals, and this is great for consumers. But I recommend that all adults supplement with vitamin D, to not take a chance that you would ever be deficient in such an important nutrient that's so vital for broad spectrum health protection. The way you want to supplement is with vitamin D3. The D3 form is much more bioavailable than the other form of the D2 form that you may also find on the shelf. And you need to consider the amount of vitamin D that is in other supplements that you take, because it's typically found in multivitamins. It's commonly found in combination with calcium supplements. So look at your other supplements, but you want a total daily dose of around 1,000 IUs. You can safely take up to 2,000 IUs, and there's very good evidence that they may even bump that way up based on studies that are coming out. If you have a medical issue, if you take prescription drugs, you're pregnant or nursing, please talk to your healthcare provider, however, before you take any form of supplements, including vitamin D. So I hope that helps clear up some of the confusion and sort of gives you a little bit more answers about why you keep seeing headlines about vitamin D. It is important to know. And this is Dr. Rand for ICU, and until next time, enjoy health.